So thank you for that lovely introduction. My name's Emily Haesler. I'm a Professor of Wound Research at Curtin University and a guideline methodologist. And I'm just going to share my slides with you. Hopefully these are coming up for you now. So today I'm going to talk to you about the International Pressure Ulcer Guideline. This is an evidence-based clinical guideline that's used in over 40 countries around the world. And in this presentation, I'm going to talk about the process we use to engage patients and their family carers in the guideline development process and the findings from a large patient survey that we undertook. So patient and public involvement is a requirement for high quality clinical guidelines, and this has been recognised by governments and other bodies that endorse clinical guidelines and support clinical guideline development. For example, the National Institute for Health and Care Excellence in the UK has started to involve patients in their own guideline development, and they recognise that patient engagement is important in attaining high quality healthcare systems. And so we have this quote on the screen. This is from the Health and Quality Safety Commission of New Zealand. This is the next frontier of patient and family engagement, using the experience, expertise and insight of patients to improve care. And this statement was published in 2015, which was around about the time that we were planning the methodology for the third edition of the International Pressure Ulcer Guideline. And it reflects that guideline development group's passion for reflecting the perspective of patients in our guideline development. The purpose of including patients and family carers in guideline development is to ensure that clinical guidelines are patient-centred and that makes them gain more trust. So involving patients in the guideline development encourages and respects their engagement in health policy development, and it empowers patients to make informed health choices. But most importantly, it recognises that patients are experts in their own needs. So to embrace the move towards patient involvement in guidelines, which was relatively unique at the time that we engaged in this process, we focused on care priorities and care goals of patients, information needs and patient problems. The first area of care goals influences the development of individualised pressure ulcer prevention plans and meeting patients' needs. So from a guideline perspective, we wanted to know what's important to patients so that we could make sure that the clinical questions answered in the guideline were relevant. Information needs influences the sorts of resources that patients might need to support a clinical guideline. And the third area, patients' biggest problems, helps us to identify areas that patients and family carers need more support in. So the biggest barrier we faced in this project was that the international guideline is used in over 40 countries. And we had a goal of engaging family carers and patients across such a huge region with very limited resources. So we chose a really practical option of delivering an opt-in anonymous online survey with mixed methods questions, collecting qualitative and quantitative data. So this survey was designed by team members who had experience in patient engagement and used simple language, a user point and click interface. We had a small number of multiple choice questions to reduce respondents' survey fatigue, but we also included open response questions because we wanted to explore the biggest problems faced by patients and their family carers. We wanted patients to really be able to tell us their story. So the survey was reviewed for face validity by the Guideline Governance Group, and then it was translated into 9 different languages. And we disseminated this survey through professional conferences, through the Guideline Development Group members delivering it directly to patients. We used social media and we used community organisations in some countries. The project had ethics approval from the Australian National University, and the survey was available online for about 6 months in the middle of 2018. And then for our data analysis, we did descriptive statistics and a thematic analysis of the open-ended question. So what did we find? Well, we had a bigger response than we really hoped for. We had over 1,200 respondents and about 380 of those identified as patients. About 86% of these respondents were from Asia, mainly China, and 3.5% were from Europe. So there's probably a few reasons that we had more respondents from Asia. First, China is over 3 times the population of Europe, so we would expect to have more Asian respondents. But the survey also happened to coincide with a lot of Asian conferences, so it got a lot of promotion in that region. And we also found that health professionals in China were able to distribute the patient survey link very easily because they have a high digital connectivity with their patients, and that wasn't the case in all countries. So when we look at the responses of individuals, and this is people who are identified as having had a pressure ulcer or being told that they were at risk, we see that about 37% of patients were aged over 60 years of age. And we know that this isn't really reflective of the risk groups, because we know most people who are at risk of a pressure ulcer are much older. And also we had younger family caregivers as well. And we think that this is probably a reflection that it was an online survey and these cohorts probably use the internet a bit more. So this graph shows the care goals of patients. Stopping any pressure ulcer was the most common, with 69% of respondents saying that that was their major priority. But 45% of patients also had a goal specifically to reduce large pressure ulcers. And we see that family caregivers had essentially the same patterns of response for goals related to pressure ulcer prevention. About 47% of patients selected reduction in the size of a pressure ulcer as their primary pressure ulcer healing goal. So reduction in pressure ulcer size was actually selected more often than completely healing a pressure ulcer. And I think this is really important information for health professionals who can become really disheartened if a pressure ulcer doesn't heal or it takes a really long time to heal. Just to know that for the patient, reduction in the size of that pressure ulcer might have already met their main goal and made a big difference to their quality of life. And once again, patients family caregivers responded very similarly. Here we have responses to pressure ulcer symptoms, and we can see that 46% of patients had managing pain as one of their main care goals. And here only 36% of family caregivers had similar goal, and this was one of the only statistically significant findings in our survey. So I think this is really important to be aware that when working with family carers advocating for a patient, just that pain management isn't overlooked as a goal. With respect to information needs, all of the dark and light blue in this chart indicates strong agreement or agreement that various clinical topics are important for patients to receive information about. So basically, patients and family carers agree that they need information about all the topics that were eventually covered in the international guideline. Here we can see the top 5 information needs that were identified by patients. And this is quite interesting because 2 of these top 5 areas, health professional education and facility-based pressure ulcer prevention plans, are actually quality improvement initiatives of an organisation or a wound service. So these are possibly areas that we give patients less information about. And it reminds us that an effective facility-based pressure ulcer prevention plan needs to engage patients and their family carers. So caregiver responses were fairly similar. They had the same priorities for organisational level quality improvement initiatives, which are the ones in red. But it's important to look at these in the context of the very first slide I showed about information needs. And I think the take-home message is that your patients and their family carers are likely to be highly receptive to information about any pressure ulcer topics. So we asked the survey respondents an open-ended question about their biggest problems related to pressure ulcers, and over 500 respondents provided short answers. These were translated, and then we used a thematic approach to identify the key themes and categories and subcategories. So the data contained 5 major themes, and these were health, the wound, care, information, and quality of life. So first, for many patients and family caregivers, their overall health and the resulting pressure ulcer risk factors were their biggest problems. So they recognised that being limitations in their moving and repositioning was a problem, and that this led to an increased risk that they would develop a pressure ulcer. So these respondents basically looked at the primary cause of their pressure ulcer, their reduced mobility, and recognised that it was their biggest problem. Other health problems such as frailty and cardiovascular disease also increased the risk of getting a pressure ulcer, and also it impacted the ability of patients to implement preventive interventions such as repositioning. The wound, the pressure ulcer, was central for most of respondents. Patients and family caregivers referred to difficulties in getting a chronic ulcer to heal. They referred to dealing with many remissions and recurrences. They talked about complications such as wound odour, exudate and infection as being a major concern. And a theme of concern relating to caring for the pressure injury, knowing the way to clean and dress the wound was also evident for many patients and their family carers. So the primary theme around care referred to accessing care services, and this included accessing both informal and formal caregivers, and also equipment such as mattresses and beds. And these responses are from people living in the community who are at risk and have limited access to equipment that they need to help them stay pressure ulcer free. So this reminds us about facilitating our patients to access the equipment they need, particularly beds and mattresses and seating supports. And financial costs did come up in this theme, but that was primarily related to the cost of wound dressings, which is different in many different countries. So information theme identified the concerns that patients and family carers have regarding the knowledge, attitudes and skills of their health professionals. And this reflects what we saw in the quantitative data, that patients are interested in quality improvement initiatives. But patients also identified their own lack of knowledge and self-care abilities and noted that this was a big problem for them. And we also saw that in the quantitative results, where they indicated that they needed information on many topics. And the final category that we found in the qualitative data was quality of life, which was a significant theme for both patients and family carers. So patients referred to pressure ulcer symptoms that impacted their quality of life, particularly pain, and this converges with the quantitative survey findings that almost half of patients had managing pain as a primary care goal. But for other responses in this category referred to the psychological burden of pressure ulcers, fear, and family carers' burden of caring. So how do we use the survey information? So in the clinical guideline, all the evidence-based recommendations have a strength of recommendation, and every one of these strengths of recommendations indicates how likely implementing the recommendation is to achieve more good than harm for a patient. So using a grade approach, we assigned strengths of recommendations, and the development team considers in that not only the volume and the quality of the research, but also the acceptability of an intervention for patients, whether it's feasible for patients and whether it's a priority for patients. And this all feeds into the strength that any given recommendation in the guideline receives. So there was some specific recommendations in the guideline that the survey results supported. And the first of these is to set treatment goals that are consistent with the values and goals of patients. And this includes reconsidering those goals when the pressure ulcer isn't getting smaller. And also important to remember to incorporate family carers in goal establishment, because as we saw, family carers have very similar goals to patients for the most part. The second good practice statement there that's in the guideline is about assessing health-related quality of life and knowledge needs. And we know that's very important to know what deficits are before we can help patients to learn what they need to know. And the third there is an evidence-based recommendation about providing pressure ulcer information. And the guideline includes strategies on how you might do that, including routinely discussing pressure ulcer care with patients, using evidence-based education resources, and using a range of different education delivery models. So this study has just been accepted for publication in the Journal of Tissue Viability, so look out for that in the next couple of weeks. And you can find more information about the International Pressure Ulcer Guideline at the guideline website. And there's also an app available that there's a QR code for on the screen. And next month we're doing an evaluation of that app. So if you download the app, you'll be able to respond to that evaluation survey. So thank you very much. I hope you enjoy the rest of the presentations today.